Hello viewers, welcome to another exciting and educative episode on HealthLink TV show. Today on the show, we are going to discuss a disease which is a major cause of premature death worldwide, hypertension, commonly known as high blood pressure. A lot of people don't check their BP unless they are sick. But has it ever occurred to you that you may be living with high blood pressure without knowing? Today on the show, journey with us as we take you through high blood pressure and how it affects the quality of life. This show is proudly sponsored by MNC Group and Prince Syrup. Let's go for a quick break. When we come back, we start our discussion on high blood pressure. Welcome back. Our guest for today is Dr. Mark Ifeonu, a medical officer at Saltpond Municipal Hospital. He is here to provide us with all the necessary information we need to know on high blood pressure. Doctor, you're welcome.
Thank you.
I'm glad to have you here. All right, so in our local parlance, we call high blood pressure as moja broso. I want you to explain what high blood pressure is for us. I don't know whether it's the same as the moja broso in our local parlance.
Okay, so if you're going to translate that literally, we're talking about more of an increased blood volume. Means you have a lot of blood, but that's not necessarily the case.
Oh, okay.
When you talk about hypertension, which is a medical term, we're talking about persistently high blood pressure. We have the values that we use for this. Where numerically, you say blood pressure of greater than 140/90 millimeters of mercury.
Oh, okay.
That's high blood pressure. Although an increased blood volume can affect the blood pressure, but hypertension does not mean increased blood volume.
Oh, okay. Doc, how often should I check my blood pressure?
Okay, so we have recommendations for screening for high blood pressure. That's for people who have not been previously diagnosed with hypertension. So generally, for people less than 40 years of age, we recommend that you check your blood pressure at least once every 3 to 5 years. That's
once every 3 to 5 years.
For people with normal blood pressures below 120/80. And then when you have a blood pressure a bit high, above 120 but still less than 140, you want to check it at least once every 2 years.
Okay.
Yes, so that's the recommendation. And then for those who are already been diagnosed with hypertension, your doctor is going to recommend how regularly you have to check based on your stage of treatment.
Okay. What about when someone is having a pre-existing condition, like any other chronic disease apart from the hypertension?
Yes. So with increased risk factors like other chronic conditions and increased age, you have to check or screen for hypertension more frequently. Okay. And that's going to depend on the particular condition that one has.
Right. So Doc, which group of people are at risk of hypertension?
There are several risk factors that put someone, at the greater likelihood of having hypertension. Okay. First, with increased age. Okay. So, as one passes 40 years, the risk of having hypertension increases. For women, after menopause, the risk of having hypertension increases. Okay. Men generally are at a higher risk of having hypertension than women.
Doc, why is it that men are at higher risk of hypertension than women?
Well, there are several genetic and environmental factors that contribute to that.
All right.
But men generally have a higher risk for hypertension. Okay. And then you have other comorbid conditions like high cholesterol, obesity. Okay. Yes, so all of these together puts people at increased risk of having hypertension.
So, Doc, does geographic location and race affect your blood pressure?
So both of them actually go hand in hand. Okay. With the geographical location, it's actually more race dependent. Okay. So we have certain races that have a higher risk of hypertension. Okay. Unfortunately, the black race actually has the highest risk for developing hypertension.
Okay.
So it's not really dependent on a particular geographical location.
Okay.
Yes, but it is more dependent on the race.
Okay. So now we know that people who are exposed to it, what causes hypertension in these people?
So hypertension basically is an increased pressure at which the blood is flowing in the blood vessels.
Okay.
So what the process that actually starts this is when the blood vessel starts becoming stiff. Usually the blood vessel would expand to accommodate the changes in the pressure in the blood. But when the blood vessel starts becoming stiff or gets narrowed.
What causes the narrowing of the blood vessels?
So the risk factors that we have stated earlier directly contributes to this stiffening and narrowing of the blood vessels. With age, the blood vessels get less elastic. With diabetes, you have distraction basically in the blood vessels.
Distraction?
Yes, there are certain processes in diabetes that cause a dysfunction in the blood vessels that increases the likelihood of the blood vessels attracting clots, other cells that together, narrow the lumen or the passageway for the blood. So all of these cause stiffening and narrowing and then increases the risk of getting hypertension.
So Doc, we have pregnant women who develop hypertension during pregnancies. Others are also hypertensive even before pregnancy. And I've seen older men and women who are hypertensive. So I want to find out, are there types of hypertension?
Yes, we have types of hypertension. For this, with regards to your question, we're going to classify hypertension based on the cause. So with this classification, the first and the most common is what we call essential hypertension. Essential hypertension is the one that develops and then the primary cause is unknown, but this is the most common type of hypertension, accounting for greater than 90% of cases. And then we have what we call secondary hypertension. So with secondary hypertension, usually we have implicating factors, which usually when you solve those problems, it takes away the hypertension. It mainly has to do with some hormonal issues, like thyroid issues and all of that. And then you have drug-induced hypertension. Yes. So usually these ones, when you solve the underlying condition, usually resolves the hypertension. Then we also have hypertensive disorders in pregnancy. Yes. So with the hypertensive disorders in pregnancy, some of these women have chronic hypertension. Hypertension that may or may not have been diagnosed before the pregnancy. But because it is mandatory to screen during pregnancy, then sometimes it is first diagnosed during pregnancy. Yes. And then we also have hypertension that is caused directly by the pregnancy. Yes. These ones are also a different group. And then usually after the pregnancy period, it resolves.
So as a normal person with no pre-existing condition, how will I know that I have high blood pressure?
Well, so two major ways that people get to find out they are hypertensive, either from routine screening or they begin to experience complications of hypertension. And then when they arrive at the hospital, based on the presentation the person has come with, we get to do the other screening, and then that's when we realize that this person has hypertension. So for following the recommendations we have for screening, that's where a normal healthy person without symptoms can find out that they have hypertension.
So meaning hypertension can't present itself with its own signs and symptoms unless you have a pre-existing condition.
Yeah, I mean, hypertension itself is asymptomatic. It doesn't have symptoms. Yes, the symptoms of hypertension usually come when you have a complication of the hypertension.
Let's go for a quick break. When you come back, doctor will throw more light on the relationship between hypertension and diabetes. Welcome back. Before we went on break, we were discussing hypertension and the types of hypertension. Now let's move to the relationship between hypertension and diabetes. So Doc, I've realized that people who are hypertensive are mostly diabetics. What is the relationship between hypertension and diabetes?
Yes, like you rightly said, we have a lot of people with hypertension also being diabetic. We have what we call, there's an association, what we call metabolic syndrome, between hypertension, diabetes, and cholesterol problems. They usually coexist in the same patient. Well, directly, diabetes can increase the likelihood of having hypertension, and then both of them together also have similar complications. So the complications of diabetes and hypertension usually affect the same organs or the same system. Yes, so there's a direct relationship between diabetes and hypertension, and then having both of them together puts you at a much higher risk of having a complication.
But Doc, how does the diabetes increase your blood pressure?
Yes, so like we said, when you talk about increased blood pressure, you're talking about, the pressure or the force with which the blood is going through the arteries. And with diabetes causes it adds to the dysfunction and stiffening in the blood vessels. So when you have diabetes, that's how it can directly increase your chances of having hypertension, directly from the blood vessels.
Okay. But then are there some drugs that can increase your blood pressure?
Yes, there are some drugs that can increase blood pressure. Of particular importance is steroids. Steroids are contained in bleaching creams and all of those things. This is one of the most common drug causing hypertension in our setting. You also have other recreational drugs like cocaine, amphetamines, and then different combinations of these recreational drugs that can increase the blood pressure.
All right. Doc, let's go back to the pregnant women. Why are some pregnant women hypertensive during pregnancy?
Okay, so with the hypertension and pregnancy, we have several risk factors, beginning with age. Age of pregnancy above 35 years puts you at an increased risk. You have a history of hypertension in a previous pregnancy, that puts you at an increased risk. You have family history. Those are the family history of hypertension during pregnancy. We have people with multiple pregnancies, like twin gestation, triplets, puts you at a higher risk.
Doc, hold on. The triplets or the twin gestation, how does it increase your blood pressure?
Okay, so that is mainly from the placenta, because there's a particular type of hypertensive disorder in pregnancy called preeclampsia. And then this comes directly from the placenta. The placenta is the main cause. So when you have multiple pregnancies, you usually have a bigger placenta, and that will put you at a higher risk of getting hypertension.
Okay. Please, Doc, let's go back again. You said a condition, that is preeclampsia. So how does the preeclampsia also increase your blood pressure? Okay.
So there are quite a number of theories with regards to how exactly preeclampsia increases the blood pressure. But basically, if you want to summarize, you know that directly from the placenta. Now, the placenta is what transfers nutrients and oxygen from the mother's blood to the baby's blood. Now, when there's a problem in the placenta, usually because the blood vessels in the placenta are not adjusting based on the baby's requirements. Now, in order to maintain the perfusion or delivering nutrients to the baby, there's a reflex that increases the mother's blood pressure to increase the blood supply to the placenta. And then when this keeps happening, then the mother's blood pressure becomes persistently high. Yes.
All right. I believe a lot of people want to hear this question. How can I manage my blood pressure as a hypertensive patient?
Okay, so First of all, managing hypertension is instituted at the hospital. Yes, the treatment facility. So usually we will start by non-pharmacological strategies. That's for people who are diagnosed based on screening. But if you have come with a complication, we usually would add the non-pharmacological or the non-drug therapies to the drug therapies. Yes. So for the non-drug therapies, we have lifestyle modifications. We usually would encourage people to restrict salt intake or reduce the salt intake. You want to promote a healthier lifestyle, controlling the other risk factors like diabetes. You want to encourage weight loss, healthier eating, increase the vegetables, fruit intake, and then reduce the consumption of saturated fats. Yes, so these are some of the strategies. And then, of course, exercising. These are some of the strategies you use without drugs to help control the BP. Now, if these fail, then we have the drug therapies. Yes, so in black people, we have the more common drugs that are used or recommended for black people. Yes, so those are the thiazide diuretics. We have calcium channel blockers like amlodipine, nifedipine.
That is more technical.
Yes, so those are more technical. But in summary, managing hypertension has to do with both non-drug therapy and drug therapy.
All right.
Yes.
Okay. So, Doc, what are some of the side effects of these drugs?
Well, with the drugs and the side effects, they usually it would be dependent on the particular drug that you are taking. But of course, if it's recommended for use, then the side effects are usually tolerable. And then when you have side effects that you can't really tolerate, then we can find an alternative. So some of the common side effects that we have are, headache. You can have headache, you can feel dizzy. Yes. And of course, you can also have a decreased blood pressure lower than the expected rate. That is a natural side effect.
Is it when you overdose or?
Yes. If you don't respond normally to the medication, or when you are taking a higher dose than is necessary, you can have a reduced blood pressure.
All right. Doc, those who skip their medication, what are some of the complications associated with high blood pressure?
Yes, so for complications of hypertension, they mainly have to do with, these are what we call cardiovascular diseases. Yes, so they mainly have to do with the brain, the eyes, the heart, the kidneys, and the limbs. So with the brain, you can have a stroke. With the eyes, you can, it can cause poor vision. Yes, so you have retinal diseases, so it causes poor vision. With the heart, of course, you can have a heart attack. You can get a heart failure from this. With the kidneys, you can get a kidney failure. And then with the limbs, you have what we call peripheral vascular disease. It's basically, the same thing that happens in the heart or the brain. When the blood supply has reduced because of this stiffening and reduction in the passage of the blood vessels, then you have diseases affecting the limbs because you don't get enough blood supply to those areas.
All right. Now, I want us to move to COVID. Hypertension is a comorbidity. What is the relationship between the COVID and hypertension? Because I know and I've heard that hypertension reduces your survival rates or the chances of survival as a COVID patient.
Well, as with any condition or disease that a person might have, increased age is usually a great risk factor. It puts you at a more disadvantage. And then you realize that most hypertensive people are elderly people or older people. There is no direct cause, or rather identified cause in hypertension that increases your risk for COVID, but we know that hypertensive people have a greater risk for more severe COVID-19 infections.
Okay.
Yes, but the direct linkage between hypertension and severe COVID is still being studied.
Okay. Doc, my last question for you. You said obesity puts someone at risk of hypertension. So does it mean that normal weight or average weight doesn't expose someone to hypertension?
Well, obesity is just one of the risk factors. You can still have other risk factors even if you have a normal weight.
Okay.
Yes, but obesity itself increases your risk of getting hypertension. Doesn't mean that people with normal or desirable weight cannot get hypertension.
All right. So, Doc, what advice do you have for our hypertensive patients and those who are not hypertensive?
Yeah, so beginning with the non-hypertensive patients, we have to know what position that we are. We have to be aware of our chances of having hypertension. Because like we said earlier, those with increased risk factors should screen for hypertension more frequently. And then with those who are hypertensive, considering the fact that this is a leading cause of mortality, and then most of these complications are preventable when the blood pressure is well controlled. I would advise that you stick to the lifestyle modifications and also adhere to your drug regimen as much as possible.
All right, thank you so much for your advice, Dr. Ifeonu.
You're welcome.
We really appreciate your time with us.
It's my pleasure.
Great. Viewers, if you have any question on hypertension, kindly drop it on the number on your screen. Let's join Dietitian Ni as he educates us on healthy eating habits for hypertensive patients. Welcome to the Dietitian's Corner. As Doctor said, healthy eating habit plays an important role in managing.
So the people that have high cholesterol levels so we always try to give them the complex carbs high in fiber to help control the cholesterol levels as well as the weight, which are the risk factors. Then also we have the vegetables here. As you can see, it's very colorful. Now, the hypertensive patients, there's a lot of problem in relation to the blood vessels. Those are the oxidation. We call it oxidation. We talk about inflammation in relation to the blood vessels and also pressure on the heart. So we have the vegetables here. Also has fiber. They also have the antioxidants. Those ones also help. So you can see we have a colorful display. We have green, we have red, we have yellow. The colors of vegetables has something to do with the antioxidants I'm talking about, which boosts the immune system of hypertensive.
Can a hypertensive patient snack on fruits?
Yeah, they can snack on fruits, but the only thing is the portion size. As I was saying, the portion size, your weight is a determinant of your portion size. So somebody who's very big will have a quite substantial amount of fruit as compared to the other persons. So the hypertensive can, but you need a dietitian to help you to know the amount. Yes. So now fat here plays a role in hypertensive. Now people that are high cholesterol levels have higher increase for hypertension and also stroke. So what we say that we need you to go for the good fats, but let's look at the fats from the protein. So we tell you to go for the lean protein. So the lean protein are basically proteins that do not have much fat inside. So let's go for our fish. Now our oily fish here have good fats called omega-3 fatty acids. Those one really helps.
What's the importance of the omega-3?
So the omega-3, they are good fats. They are antioxidants. So they also prevent those damages to the blood vessels. But for the chicken, the only problem here is that the chicken skin has saturated fat. Those are the bad fats. So we have two types of fats: the saturated fat and the trans fat. The trans fats are basically the fats in the biscuits. Those biscuits, the baked products, the pastries. Those ones, what really happens is that the fat was put under pressure with heat. So it converts the good fat into trans fat. Now it becomes rancid. So it becomes, the quality of the oil becomes poor and it can affect. So we always advise that if you want to go for the chicken, you can just take the skin off, take the saturated part off and enjoy your, but don't fry. If you fry, you add more oil. So we expect it for you to grill. When you're grilling, you can just spice with the natural spices. That's what I'm talking about, that one. Then the egg, you can go for 1 egg a day, is okay for an hypertensive. But the only problem is if the person has cholesterol problems, we also advise that you can take the egg yolk out so that we prevent.
What about fried egg?
Yeah, so the frying of foods adds more cholesterol to the diet. And the problem here is some people overuse the oil.
Okay.
We advise that you do shallow frying, so the little oil that will be left, you can throw it away. If you put oil down, let's use this example, the palm oil. Okay. So you see the palm oil, you have the parts that you can't watch him say ada, or let me literally say sleeping oil. Okay. Looks very dull. Okay. Those one is higher in saturated fat. Okay. So we expect when you're going to buy the palm oil, look at the top one. Use the top, the one that's when it sits, you don't see it having that dull surface. So we say it's liquid at room temperature. Okay. So we expect you. So if we go, so we say that the coconut oil and the palm oil are high in saturated fats. Only if you use the ones with the liquid portion. Okay. But we advise you can go for the canola oil, you can go for the sunflower oil, the olive oil. Those are healthy oils. Contains the omega-3 fatty acids that we need.
Let's come to the salt. I heard that hypertensive shouldn't eat salt at all. How true is that?
No. So it's not true. Okay. The salt has a very good importance to the hypertension. If you take it out at all, the person will have low blood pressure. We have our salt here. So you just measure 1 teaspoon. That is the amount you're supposed to eat throughout the day. Okay. You're not supposed to eat too much. So the way to control your salt is make sure that when you're eating at home, see sometimes people can, whilst eating, they have salt shakers. Yes. They'll be stirring. Use those kind of habits are not good. Whatever it's prepared and the food is done, please don't add any extra salt.
How should a plate of a hypertensive patient look like?
So I'm an ever. I love banku myself. Okay. So I'll go for 1/4 portion of this place goes for my banku or my ekple. Okay. Then the other portion goes for the fettuccine or the okra stew. Then if I want to go for my fish, as I was saying, the healthy fishes, the olive fishes, I go for the salmon or tuna, this portion. Okay. So I have a healthy plate for myself.
But can you mix both the salmon, tuna, and chicken in the same meal?
Hey. so too much of everything is bad. So what we say that you see, that is why we always advise is get a menu plan. Okay. So in a menu plan, you can enjoy chicken for Monday, enjoy salmon on Tuesday. You can have so they can enjoy a variety of foods. All right. And that will be very good for yourself. Yeah.
Thank you, Daisy Sheni.
You're welcome.
We are glad to have you here. All right. Okay.